So your question for me is, why is it not going away? What is the discriminator? What is the disease that's causing back pain symptoms? Well, primarily back pain is a functional movement disease. That's what I've synthesized it down to over the last 20 years of working in the spine industry. It's primarily a functional movement disease. That's the first thing that goes wrong, is our movement proficiency. And then after movement proficiency sets in, we then start to get these secondary things developing, inflammation and then structural breakdown of the spinal integrity. And if we start to do these types of therapies, we're not addressing the primary driver, okay? We're addressing downstream problems, and that's what this slide represents. A lot of people will say that my diagnosis is bursitis or tendonitis or arthritis or a disc bulge, okay? These are your downstream problems. These are your secondary dominoes to fall over. And I do surgery for this. I do surgery for this. Mark would probably do some treatments for this and this and this, okay? But if you only target these downstream dominoes as your treatment and you don't fix this up, you're going to continue to have to keep treating those downstream problems. It makes logical sense to also involve something that stops the first domino from falling over, okay? And if we conceptualize that movement dysfunction is the first domino to fall over, we can now start to develop a treatment plan that is very focused and specific on stopping that domino falling over, okay? You probably haven't heard of it, but there's a database of research papers that all gets collaborated in what we call the Cochrane database. And I looked up Cochrane for various forms of treatment of back pain, all the common ones. You know, so we've got exercise therapy, we've got manipulation, we've got Pilates, we've got massage. These are the very common therapies that most people, almost every patient that I see who have had back, that have done at the very beginning of their pain symptoms, and there's no evidence to support it. Yet that's the reflex action that people do, is they go straight into those rub downs and exercise and core strengthening, and then they get desperate, right? And then they start to do all these. They jump on Google and look for back pain remedies, and you know what? It's a $100 billion industry, $100 billion industry of gimmicks to try to help people who are desperate to fix their back pain. And not one of these devices will actually eliminate the discriminator. Not one of these devices will actually eliminate what caused their back pain symptoms in the first place, okay? So I thought we'll just bring the whiteboard out and go through your history so that you can tell me a little bit about your condition, and we're going to just break it up like this, and as we evolve this, it'll help create a clear picture as to what the message that we're trying to get across. So let's break it up to, say, symptoms, and we'll just mix them all up. So maybe start with Emma. Like, can you list off some of the symptoms that you're getting?
Probably symptoms is neurological pain.
You're getting neurological
Different
pain?
types of pain. So like sometimes it's like my toes go numb, or
Okay.
I'll just get.
So let's just use symptoms. Let's not use neuro, because you don't know that, right, Emma? So unless someone's told you that, and it may or may not be right. So do you have numbness?
Yep.
Whereabouts?
Toes.
Toes? Anywhere else? Just both sides, left and right?
Yeah, both sides.
Bilateral?
Like tingling, you know.
Tingling?
Pins and needles, that type of thing.
Is it always in the same spot, or is it in?
It just varies.
It varies?
Yep.
Yeah, varies.
from side to side.
Okay, it goes from side. Sometimes it's left, sometimes it's right. It's variable. And so when you said the word neurological, does that mean that it feels like there's a nerve compressed?
I did have that, so I've had a discectomy L5S1.
Yep.
But since the surgery 3 years ago,
Yep.
it's obviously never been the same.
Yeah, so you've had a discectomy.
Yeah.
Excellent. So that's another symptom. Needing a discectomy is sort of like a symptom and a treatment.
Yeah, so I don't get that. Like that was terrible. Like
Yeah.
all of that. That was the shooting.
Yep.
Horrible stuff.
Yep.
Sometimes I get a little bit of shooting pain and stuff like that. But
Yeah.
yeah.
And any pain symptoms across the belt line?
Yeah. So my hips get more sore than my actual lower back.
Hips being here, or hips being down here, back there. Okay, the side.
The thing is, because I've had 2 babies in the process,
Mm-hmm.
I don't really know, like,
Yeah.
with my SIJ, I don't really, so there's a few things.
Okay, so there's a whole numbness, tingling. Sometimes it's left, sometimes right. That's reassuring to me that it's variable, because if a nerve is compressed, it's always on one side.
Yeah, so I've had that.
Yeah. And so.
But I don't know why I get on the other side.
Yeah, no, that's right, exactly. So we want to dispel that myth that there may still be a nerve root that's compressed, because otherwise, if there's a nerve root compressed, that means the thing that's compressing the nerve is going, oh, today I'm going to compress the left right, today I'm going to compress the right, now I'm going to press the little toe, now I'm going to press the outside toe. It's highly unlikely. I don't know of any condition that would move around like that. But there's another, that doesn't mean you're not,
That's a good thing.
you're feeling it. I'm not disputing that you feel that, but we have to understand what the discriminator is that's driving that. Okay, Paul.
Would be like dull ache.
Left.
And not the same in terms of the tingling,
Dull ache.
that sort of stuff. And but I can certainly relate to the cramping, like that it feels like around the hips and like
Cramping, tightness.
yeah, like when things get real bad, stuff like the hips will cause more pain than the actual back. The back will be aching, but laying on the side, that sort of thing will be unbearable. And I guess it sort of feels like I've got rockets strapped to me when it gets real bad. And,
in the groin region too.
Yeah, like sometimes, like nowadays it's a lot better than it was like 6 months ago, but like particularly, it almost feels like it's a band.
Yep.
And sensitivity to stuff like actual belts and long pants, so I'm constantly in
Sensitive,
shorts.
So intolerance to just anything that's sort of mildly.
Yeah, it's as if like the pressure of anything sets it off like a warning sign on like a lighthouse.
Patrick?
Just like a pretty constant dull ache, like all
Across the
along
back,
both sides.
Belt line ache.
Pins and needles every now and again, moving down into the glutes.
Yeah. Glute.
Tight hamstrings. What else?
Tight hammies.
That's pretty much it.
We'll talk to you about tight hammies later. Chris?
So many people get told that, don't they?
Yeah.
Yep. Yeah, mine's more sort of around
thoracic,
like upper back.
Upper back, yeah.
So like just to the right of my spine, like I'm sort of standing
Just
up.
point to it. Just right.
Just sort of like.
Okay.
Like
Sort of.
It's like the same pain every day. I get like after work, and
Yep.
it's like my neck is like constantly sore though. So like I usually get that off being at work for like maybe 6 hours on my feet for like 10 usually in a day. And,
Yep.
I'm a chef. So yeah, constantly like leaning over benches and things. I think like just puts pressure on one like part of my spine.
Cool.
Lots of awkward lifting.
Does it go down to? Into the lumbar region?
No, not lower back is like fine. I mean, yeah, it's just mainly like this one spot. It gets like super sharp and painful, like at a certain point in the day.
Yeah.
And but like there's always like a constant like neck tension as well.
Is your
like
bench
always.
weight good for you, do you think?
It's probably okay, but the thing is when you're
down,
chopping and things like that, you always have to be. You're always looking down. You're always plating like downwards. So my neck's like out here, and like I feel like it's causing unnecessary weight.
These are the sensations that you feel that we really, we're trying to work out why. But that's what your body feels. That's what your brain's telling you. That's what you're experiencing. So, Snezjana.
Yes, and I have to apologize. I'm not really good at using proper words.
That's okay.
I explain my pain, but basically it's ongoing. It's a constant.
Yeah.
It's actually in the really low area.
Low lumbar.
Yes, yes.
On one side,
It's
a
like
little bit
my-
to one side.
More to
Yeah.
the right.
Yeah,
Yes,
right,
it's
lum.
my best friend now, but sometimes it's not.
Yeah.
So I'm really stiff.
Yep.
I find myself at work
Yeah.
avoiding all sorts of positions, all sorts of movements. So
Indeed.
the more I avoid, I think
Yeah.
the less I
Okay. Don't tell us about avoiding it. We'll go to that in a second. So, and all of you, this is not just like for 1 week.
Yeah.
This is not just for the last weekend or 2 weeks or 3 weeks. This is how long?
Oh well, my surgery was 3 years ago, but before that, you know, I didn't have that. Like I just sort of sore back every now and then.
Yep.
So I don't know, and I'm a PE teacher, so I probably
Yep.
don't move properly. Yeah.
Yep.
Maybe,
So we're talking-
I say 5 or 6
Yeah.
years. I mean,
Paul, how long?
15 months.
15 months. So we had 5 years, 15 months. Oh, we'll say one year, 1.5 year. Patrick, how long?
3 or 4 years.
3 or 4 years. Gee whiz. Chris,
Probably say like nearly 10 years.
10 years. And how many years now?
This sort of pain around 5-6 months. So
Yeah.
I had pain in my back
Yeah, that one. How long?
years, but this pain around.
You can't remember forever.
No, April. I remember like
No. The long-term back pain.
the long term, like last few years.
Few years.
Yeah, that's
So 10 years ago, you're fantastic.
yes,
Perfect.
that was-
Okay.
yeah.
So
That was actually quite-
3 years.
Yeah.
Okay.
2 years, all sorts of
Now imagine having a cold or a sniffly nose.
I can't sneeze.
Imagine having a sniffly nose for 10 years, Chris. Would you go and go, what the hell's going on here? But this is the thing, when you have back pain, it's like, it's okay. I've had it for 10 years, that's cool. But if you had sniffly nose or a red eye or a, drooling saliva from your mouth, you'd go, what the hell's going on? This is a bit ridiculous, 10 years of drooling mouth. You'd sort it out, right? You'd want to know why. You'd go and knock on a doctor's door and you say, what the hell's going on? But with back pain, what's causing your back pain?
What's causing it?
Yeah.
Oh, well, I got like chiropractic.
This is
It's
a
been like,
hypothetical question,
oh, okay.
rhetorical question.
Right, sorry.
Okay. But so what have you? Let's go to a different colour now. What's actually I'm going to make not much room here, but what have you done for it?
well, I had a discectomy. That wasn't really a choice.
You had a discectomy.
Well, I don't think it was a choice at the time. Since then, I've done everything. So
Very
Pilates,
There you go.
massage. I avoided having children. And just
Avoided.
yeah, I did. But I waited until my back was.
Yeah.
I thought I was feeling better.
Okay. So you maladapted. You wanted to have children, but you said no. I'm not going. You stopped.
Lots of
Okay.
running. I used to do a lot of running.
Yep.
I just feel like I can't.
Maladapted. So stop running, and running's great for you. Stopped working. Goodness me. What about you, Chris? What have you done? Paul?
Nerve blocks,
Oh yeah.
cortisones,
Nerve blocks.
PRP,
PRP. Cortisone.
countless physios.
Countless physio.
Yeah.
What did the physio do? Just give me an average of what they did most times.
Most of them, almost nothing. They would just.
No. What did they do? You obviously.
They assess the area, and often you go down that.
Did you lie down on the couch with them?
I was laying down there. Yeah.
Couch.
Chiropractors.
Lots of couch work.
Yeah.
Lots of times you'd be on a couch.
Laying down, they
Yeah.
would try and release some things, get me to move
Couch.
areas around.
Couch.
give me one
Rel-
exercise.
Releases. Yep. Okay. Cool. That's heaps. Right. Patrick.
Yeah, chiropractors, physios,
Same.
cortisone.
Same.
Yeah, it's all.
Anything else? Nothing else. Chris, anything different?
No, just chiropractor.
Chiro. I didn't put chiro really. What is the? Tell me one thing that the chiro does for you. Is it the same thing? What are they doing?
Aligning?
Aligning. So they're cracking you or manipulating you.
Yeah, I guess so.
So there is some manipulation.
Yeah.
Just what some chiropractors do, like acupuncture. Or so I just have to define chiro. So what depends which chiro you see. And so what have you done mostly?
with physio, but that was massage and putting some technique.
Massage, magic hands, and magic water bottle.
Yeah, but the last physio actually did suggest something like this because we tried to do exercises and then I was really not.
And there's something-
comfortable, And then she said
Yeah.
to something like this. She said.
Okay, so we've got a fairly constant theme here. And then, so if we look at, now we start to think about cause. or disease, okay, because pain is not a disease, right? Pain is a symptom. So now we're going to start to look at what are we doing on this side of the board, okay? Because everything that you guys have said, 100% of it is for this side of the board, symptoms. This is the most important outstanding deficit in your management over the last, I don't know, 50 years, okay? 50 years of pain combined. And we have to break that into two things. So we have the structure of your spine. Okay, because obviously if you had an infection in your spine, a cancer in your spine, a broken bone in your spine, a ruptured disc in your spine, that is going to be a structural cause for your pain. Okay, and that's why I get all of you to have an MRI scan, because I want to look at the structure. There's no point me sort of giving you a treatment when there's a rip-roaring bone tumour or something going on. You've got to fix the structure. And then the other thing that drives or is the cause for pain is the function. Okay, and they are very closely interrelated. If I have a structural problem, I will have difficulty functioning correctly. If I have poor function, I will develop structural breakdown. So they're interrelated. We want to optimize this interrelationship between structure and function. Okay? So when I look at structure, I'm looking at the MRI, okay? I'm looking at the discs, I'm looking at the joints, I'm looking at the muscles, I'm looking at the ligaments, I'm looking at the tendons, I'm looking at the nerves, all right? That's what I'm going to fix up as a surgeon, structure. Luke's going to talk to you about function. But if we actually think about our skeleton, there he is. Oops, our Mr. Bones here. What is the prime function of the musculoskeletal system? What is the prime function of that? Why do we have that? It's to allow us to move, okay? If you're a little slug, you're not moving very far because you don't have a skeleton. You don't have muscles. You don't have bones and joints. So you're a slug, you're there, okay? So the skeleton is to allow us to move. Now, if we've got a problem with the function of the skeleton, because the spine, this is our axial skeleton, if there is a problem with the function of the skeleton, and our primary goal of having a skeleton is movement, what is the dysfunction? Okay, it's a movement dysfunction. Boom. Okay, so if I MRI all of you, and I'm going to show you MRIs later, and I can say to you guys, it's pretty good. It's not too bad. It's not devastatingly broken. There's no cancer. There's no fracture. There's no infection. There's no spinal cord compression. There's no nerve root compression. If I say that, I can give you a tick here. Okay, I'm going to give you like maybe a B+ or something. Maybe not an A, because you've all got a bit of degeneration. Okay, it's very rare that I give people an A for their spine. But if this is a tick, this is the outstanding problem, okay? And so I want to focus all my attention to eliminating movement dysfunction, okay? Because that is the driving, this is not really a driving factor anymore, but this is the most powerful driving factor that's creating the disease, that's creating the symptoms, that's creating all that stuff that you guys said, okay? And the problem is that everything that you did here, everything, not one thing does anything for that, all right? And so all of these treatments are trying to sort this out, but it's going to fail, because if you only have a symptom-based approach, you're ultimately going to fail. These things down here do a big fat 0 for movement dysfunction, okay? So that's what I wanted to explain there. I'm going to very quickly go through that because it took a little bit longer. I'll move this whiteboard out of the way.